Hi, my name is John. I'm in Dr. Jotti's office. I come in with this: osteoarthritis, spinal stenosis, bursitis, neuropathy. I was certain I didn't want back surgery. I read of Dr. Jotti's practice. I came to see him. I had a very stiff neck a great deal of the time. To turn my head was just agony. It wasn't worth it to turn my head. My back, low back especially, the pain radiated out, and I also have bursitis so bad in my hips. If I walk any distance, they start to get stiff, and if I keep walking, I break out in perspiration from all of the pain I'm tolerating, trying to get where I'm going. Before I came here and had an interview with Dr. Jotti, I had read what he had published, and I prayed about this and walked around the house. I didn't want, and I wasn't about to have surgery because the failure rate was too bad. It's been written that 70% of back surgeries fail, or recuperation can last 18 months. My son is a prime example of that. He's in his middle 40s. He had neck surgery, and his legs don't work right. And he's still got a son to raise.
Yes.
I had open heart surgery in 2008. I had a triple bypass. I had what's called a silent heart attack. I never knew when I had it, and neither does anybody else. But all of this began to get considerably worse after the surgery. And I was slow to get around. I used to grumble and growl getting in and out of the car because I had to bend. And that was painful. I have neuropathy in my palms of my hands, the soles of my feet. That has improved. My hands are much more flexible than they were, and movement all over my body generally is better, and it's easier. I didn't have arthritis problems to this extent prior to the open heart surgery. As I got over the surgery, more pain got in to me, I guess is a word. I'd break out in a sweat walking, tolerating the pain to get somewhere. And there was some doctors had tried some pain medication that didn't work. And so, in addition to that, I'm a diabetic. And it seemed to magnify with the pain. Now, things are going back down. The markers that they test my diabetes with are going down. Everything he's doing is helping, and he's gave me a very thorough physical as well as a great explanation of what he was going to do. And after 5 sessions with him, I believe very much in the work he does. I'm looking forward to additional treatments because they are working well, and they're doing with me everything they can. I can't ask for any more. I think if you as an individual, come to Dr. Jody and explain your symptoms to him, and he works with you, you'll go home even the first day with a feeling, this man is going to help me. He's conservative in his what he can do, but he's far from conservative in what he does do. He said, he's helping me, but he said, I really don't know what he's doing. And you don't put that up for... That's what he said.
Yes, I understand. That's why we're trying to educate people as to what this is. Yeah.
Because
Okay.
I don't think anyone other than Dr. Jody and you can explain what he's doing.
That's true.
And
well, they're neurology. We call them neurology treatments because they're not drug-based. They're neurology treatments that are not based on swallowing, a pill.
Come to see Dr. Jody, Dr. Tina, with an open mind and listen. Listen carefully. Ask questions. They'll answer them to your benefit right up front. You will feel comfortable with them. They're not trying to make a sucker out of you and take your money. They want to help you.